Hello, my name is Dr. Andrew Neville. I specialize in treating adrenal fatigue and related chronic illnesses. And one of the related chronic illnesses I want to talk to you about today is allergy. Allergies are so incredibly common these days, right? But if they were more life-threatening, it would be absolutely epidemic. And what the epidemic is an epidemic of immune dysfunction, quite likely caused by adrenal fatigue. Now, let me kind of wind that back and talk about that. So we have an immune system, right? Our immune system is designed to protect us, right? So it's always sampling our environment. So we have a lot of immune cells in our throat, right? That are sampling the air, sampling the food, and it's trying to decipher friend from foe. Is this thing harmful? Can this kill me? Like a virus or a bacteria? All right, I got to attack it. And now I got to create antibodies to protect myself in the future, just in case this thing comes back, right? So it's sampling. Or is it just a harmless thing? It's just food. It's not a big deal. It's just gluten. Just swallow it. That's not going to kill me, right? Or we're breathing things in. Well, that's just pollen. That's just ragweed. Those things aren't dangerous, right? So the immune system's constantly sampling our environment. Sometimes it makes mistakes. Even in the normal course of things, it makes a mistake, and one of these immune cells grabs onto pollen and says, oh, hey, this is a problem. I got to generate some antibodies and protect it. But there's another part of the immune system, a regulatory part of the immune system that comes in, says, nope, buddy, that guy's fine. Let him pass. And then we kind of squash that reaction before it happens. So we've got this sampling, and then we've got this regulatory mechanism to kind of double check, right? Checks and balances. So under stress, okay, when the body is in a stress response and is dumping extra stress hormone, that stress hormone goes everywhere in the body, including to the immune cells. And the immune cells are spread everywhere in the body, okay? The immune system exists in a nice little balance too, right? Part of the immune cell's job is to fight infections, like things inside cells. Another part of the job of the immune system is to fight outside the cells, usually using antibodies. And it's this nice balance, and they work together. We have to have them. But when you hit those immune cells with stress hormone, that stress hormone causes a very predictable shift in this immune system, where the side that fights the infection, technically this is Th1 or T helper cell 1, that side tends to get suppressed. So we don't fight infections maybe quite as well. The other side gets upregulated, Th2. This is the side that creates antibodies to things. So now we're overproducing antibodies. Now do that once in a while, it's not a big deal, right? Start doing it all the time, and now you're going to be susceptible to chronic infections, recurrent infections, and creating too many antibodies to things. So now you're looking potentially at, allergies. You're looking at asthma, eczema, all these kind of reactive types of things, even autoimmune types of issues. So the immune system under stress starts to oversample the environment, more antibodies, oversampling, and that regulatory mechanism I mentioned, that is suppressed. So now you're oversampling, probably making more mistakes, and you miss more mistakes. Now you start developing allergies to things that are innocuous. So your immune system is now mistaking friend from foe, constantly reacting, constantly causing inflammation, and that could be environmental reactions, again, like hay fever, or ragweed, pollen, cats, dogs, things like that. It could be foods. This is why the majority of my patients come into me and they've got food allergies. Now, every time they consume or breathe in that food, now that's a stress, right? So that goes in the bucket too. But is the problem the allergy, or is it the immune system, or is it the fact that we are, most of us, stuck in this chronic stress response, which is telling the immune system to behave a certain way? You can't possibly fix the immune system completely unless you shift this physiology. This is what's driving the immunosuppression, right? Or that imbalanced immune system. And that's what's leading to the allergies. Fix this, truly, and I've seen allergies just go away, flat out go away, or at least reduce, right? Because you shifted the underlying cause. Just like my patients with food allergies, because a lot of other practitioners have dealt with their food allergies and said, oh, well, you have food allergies, that's the cause of all your problems. Well, no. I mean, it contributes a little bit, but no, it's not the cause, it's the result. But I deal with food allergies in patients as well, because I think we're scooping that out of the bucket. At least now, every time you eat that food, you're not reacting, and that's perpetuating the problem. But if you don't fix this underlying physiologic dysfunction that is suppressing your immune system and telling it to create food allergies, because we've just suppressed our immune and digestive system together. That's the environment that's going to create food allergies. If you don't fix that, you're just going to develop allergies to the new groups of foods you eat. I've had patients come to me and, doc, I can eat chicken and broccoli, or I can eat these 4 or 5 foods. Everything else I react to. This reactivity is because this system is stuck. That's what we have to fix. We have to fix that, get that unstuck. And this takes care of allergies and eczema and asthma. Even autoimmune issues are the result of this shift. So try to stay focused on that underlying cause, right? You can do some symptomatic treatment, that's fine, but don't kid yourself and think that symptomatic treatment is actually fixing the problem. I'll just take an antihistamine. Okay, and that's okay here and there, but there's a way to fix the underlying problem that is contributing to that, because otherwise you're just going to be chasing those symptoms forever, which is good business for whoever's making those antihistamines or anti-allergy kind of medications, right? Which aren't without side effect and issue. But again, you can fix the underlying cause. You just have to do it in a multifactorial way, get some guidance, do it holistically, treating all aspects of your stress response system, shifting the physiology. That's where you can get ahead of this stuff. You absolutely can. So hold out hope. All right, hope this helps. All my best.